Angelica Spurb.
Welcome today for Spurbs Herbs episode number 68. Today we are going to be talking about a very commonly used herb, chamomile. One of the reasons why I want to do it is my wife drinks it like it's going out of style, and I thought I know a lot of people do, so I thought we'd get into it. Its real name, we're actually going to find out. There's several names for this. The one I chose, the Latin name is Matricaria chamomilla, but we're going to find out there's other Latin names, and that may not be the most. We'll see. But without further ado, let's start our episode. Today's episode, as we mentioned, we'll be looking at another traditional herb of the world, chamomile. This is very commonly used herb for relaxation and to help sleep. In fact, so common, I was looking at some of the articles that are coming up, and what I saw was that this is the #1 herbal supplement in several countries, not necessarily the US, the UK, Australia, but in like Hungary, it definitely was. I think Germany was way up there. Very commonly used for relaxation and to help sleep. But are there any concerns or other uses for this herb? We will be finding out in short order. And as usual, we'll be adding something a little different. We will take a deeper dive into the important slippery pulse. Please join us for this episode. It's going to be a great one. And before we get into everything, I just wanted to ask you guys a question. Did you know that I've written a couple of books? The first book is Integrative Pharmacology, combining modern pharmacology with integrative medicine. It is a pretty thorough book discussing pharmaceuticals, what they are used for, how they work, and how they may interact with other drugs, herbs, and supplements. It is the perfect reference book for all acupuncturists, herbalists, chiropractors, naturopaths, and really any integrative practitioner. But it's also perfect for anyone. It goes in depth, but it is easy to read and has difficult terminology bolded with definitions on the same page. This is not only a great book explaining pharmaceuticals, it's also available at an amazing price. It's available for 10% off its regular price, and you get it signed by me, the author, for just $67.45. My second book, written with an amazing insurance expert, Tiffany Anderson Hefner, is called Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. This is the perfect book for any acupuncturist who wants to or is contemplating accepting insurance. It gives step-by-step advice at every part of the insurance game, from getting set up through the patient encounter and, of course, getting paid. And it begins with, should you even accept insurance? So that's not a bad place to begin. So even if you're not sure, this is a good book for you. All in an easy to digest language, honest advice, and lots of hand holding through the process. And you guessed it, it is also 10% off and signed by one of the authors, me, all for $26.98. You can get either or both of these books at the shop at www.spurbsherbs.com, SPERBSHERBS.com. Thank you for that. Okay, let's get into our pulses. So the title here is Slippery and Watery Pulse. We've been talking about the Chinese pulse for a little while now and getting into some specific pulses. I've been, talking a little bit of pulse, maybe doing something different and going back to pulses. In episode 65, so just a few episodes ago, we introduced both the slippery and watery pulse. Since that was a very important, very big herb for that episode, Fu Ling, we were not able to get too much in depth in these two commonly felt pulses. I would like to correct that and go in depth into the slippery pulse in this episode and the watery pulse in the next episode. We will reiterate what we learned in the Fu Ling episode and then go deeper into how to feel and what these pulses mean. So let's get into the slippery pulse, also known as the rolling pulse. The slippery or hua pulse is quite common in the developed nations because of our diet and potentially our exercise habits. According to Maciocia, a slippery pulse feels smooth, rounded, slippery to the touch as if it were oily. It slides under the fingers. Traditionally, it is said to feel like a string of pearls being pulled under the pulse taker's fingers. It can indicate phlegm, dampness, retention of food, and pregnancy. Generally speaking, the slippery pulse is full by definition, but in some cases it can also be weak, indicating phlegm or dampness with a background of qi deficiency. This is a common pulse because of our diet, with its refined nature and emphasis on the sweet taste, tends to hurt the spleen and cause dampness and phlegm. Notice it can be considered a perfectly normal pulse in the context of pregnancy. In fact, I was taught you could tell the sex of the baby by determining which hand is most slippery. Left indicates male and right indicates female. And I gotta tell you, I mentioned this earlier, and someone said, yes, I get the same experience and it works. And I gotta say, I've probably done this several dozen times, and probably maybe a dozen of them have come back to me, and I've been 100% accurate. So it is a really good way to tell the sex of the baby, is by feeling for the slippery pulse, which side in a pregnant lady. Flaws. So we just talked about what Matricaria kind of said, and I added in a little bit of my own. Matricaria is a very well-known author, has written several of the foundational texts in Chinese medicine for the West. Bob Flaws is another one. He's actually contributed on my integrated pharmacology book that we talked about earlier, and I know him well personally, and he's a great guy and incredibly knowledgeable. And he has a great little book called The Secrets of Chinese Pulses, or Chinese Pulse Taking. It's in the bibliography. And in that book, he says, the slippery pulse comes smoothly flowing and uninhibited. It feels smooth like pearls rolling in a dish. The slippery pulse must be pointed out by an experienced practitioner. Once one feels the slippery pulse, then its slippery quality is quite evident. Literally, one can feel its slipperiness, its rolling quality. In addition, in its pure form, the slippery pulse is uninhibited. This means that it is not irregular and that its rhythm is continuous and unbroken. He continues later on in the book. The slippery pulse may be due to any of three basic mechanisms. First, it is said that the slippery pulse is produced by blood swirling through the channels and vessels. Therefore, the slippery pulse can simply be a normal pulse, showing that there is abundant qi and blood, and that this qi and blood is flowing uninhibitedly. That's not an easy word to say, uninhibitedly. Okay, I think I did it. Secondly, a slippery pulse may be due to heat. In Chinese medicine, it is said that heat forces the blood to move. This is because heat is nothing other than a lot of qi in a relatively compact area. When the blood moves, it swirls through the channels and vessels, thus producing a slippery pulse. Typically, a slippery pulse due to heat is also rapid. We mentioned that earlier. Rapid pulse means heat generally. Third, a slippery pulse can also be the manifestation of phlegm, dampness, and stagnant food. In terms of phlegm and dampness, both of these have a common source. That source is the ability of the spleen to transport and transform fluids and humors. If the spleen loses its command over movement and transformation, these fluids gather and turn into dampness and eventually congeal into phlegm. However, this also means that there are more fluids and humors flowing in the channels and vessels than normal, and hence the slippery pulse. In actual fact, because dampness is usually due to spleen vacuity, and because the spleen is the latter heaven or postnatal root of qi and blood, engenderment and transformation. Okay, that's a lot of words there. Let me break it down a little bit. So when we say latter heaven or postnatal, what we're actually saying is, like, we're born with a bit of qi and blood to begin with, and that's called pre-heaven or prenatal qi and blood. But after we're born, that's called post-heaven or later heaven or postnatal. And the spleen is in charge of engenderment or building qi and blood, and transforming it as it's used in the body into usefulness in the body. And so the spleen is very important. Now, you might be going, spleen, if you're from a Western point of mind, what the spleen just doesn't do much in Western medicine. It does. It's part of the cleansing and does a little bit of that. But it's not a huge organ in Western medicine. Chinese medicine is an incredibly important organ. But when we say the spleen in Chinese medicine, we're kind of talking about a complex of the spleen and pancreas. If you understand your anatomy, the pancreas lays just below the spleen. And there were some old texts that would talk about the tail of the spleen. The spleen has no tail. It's like an oddly shaped balloon. There is no tail to that whatsoever. However, right underneath it is the triangularly shaped pancreas, and it can be difficult to differentiate between the two just visually. And so I think we can very safely say that when we say spleen in Chinese medicine, we're talking about spleen and pancreas. And as soon as you say pancreas, then we're talking about all the digestive enzymes and actually the way we break down food, which is a lot of what the spleen does in Chinese medicine. So it makes a lot of sense that they are interconnected. And that also goes to the root of qi and blood being from our food, engendering that comes from our food. So it makes a lot of sense that the spleen is important in creating qi and blood. Okay, so because the spleen is ladder heaven or postnatal root of qi and blood engenderment and transformation, frequently the pulse becomes fine, not slippery, when there is a gathering of dampness. It is mostly there when there is phlegm dampness or damp heat that the pulse becomes slippery in response to dampness. Likewise, food stagnation is associated with a gathering of turbidity, including turbid fluids, which then accumulate in the vessels and make the pulse slippery. He continues again later on in the book. The slippery pulse may be seen in two types of conditions. One, blood exuberance leads to a slippery, uninhibited pulse. This is the pulse of pregnancy or a non-disease pulse. Two, pathologically, this pulse may be seen in phlegm patterns, food accumulation internally stopped, or serious evil qi patterns. Therefore, the slippery pulse may be either a ping-mai, or a normal pulse, or a bing-mai, or disease pulse. So it can be perfectly normal to have a slippery pulse. But then you look at other signs and symptoms and determine if that's correct. And that's it for our slippery pulse. It's a really common pulse. Generally this, and we're going to talk about wiring in our next episode. Between those two, those are amongst the most common pulses I feel, and I think are present. Most practitioners would agree. So understanding these is important for us. Okay, let's get into our herb of the day, which is chamomile. Its family is Asteraceae, or the daisy family, and that makes sense. It kind of looks very daisy-esque in its composition, its pictures. There are two main species used as an herbal tea. The first one is German chamomile, which is Matricaria chamomilla or Chamomilla recutita. I've also seen it as Matricaria recutita. So there's a little bit, depending on the sources, you'll see different species for this. All the same species, they're all synonyms. But I think the most correct one is Matricaria chamomilla. And it is the most commonly used of these two species. The second species is the Roman, also known as English or garden chamomile. And this is Chamomillum nobile. And it is also frequently used, but not, the German chamomile is much more commonly used. As we go through today's episode, I'm really going to be talking about German chamomile because that tends to be the most commonly used one. And I think if you go and buy a chamomile tea off the shelf, that's probably the one that you're getting. However, we're going to hear this later. From a clinical standpoint, there isn't much difference between these two species. They are used exactly the same. We're going to see Holmes, as one of our authors, does make he says they are interchangeably used, but there's a slight difference between the two of them. We'll get into that, but generally they're considered clinically very similar. The medicinal part is generally just the flower, though sometimes the entire herb can be used. And other names are chamomile is actually the same name, but the British spell it without an H. So it's instead of chamomile, it's camomile. So it doesn't have the H. It's also known as pinheads, chamomilla, single chamomile, chrysocome, motherwort, feverfew. They said feverfew is chamomile can be called feverfew, but there's generally a different species that's called feverfew that's not chamomile. So I'm a little hesitant to say feverfew, but maybe close enough that they may be called that in some areas. Whitewort, mayweed, sweet false chamomile, and then true chamomile. I love that they have the sweet false and then the true chamomile as names. It can also be called Hungarian chamomile. It's interesting. In Hungary, they call this the king of herbs. So that's very cool. In the Chinese, I came up with two Chinese names for this, Huang Chu Ju and Ba Mu Nai. If I had to put my money on which one is the most commonly used, I would put it on the Ba Mu Nai one, though I don't think they weren't in any of the texts or main texts that we have, so I'm not sure exactly which is the most correct, but it is used occasionally in Chinese herbology. Let's talk a little bit about the Asteraceae family. According to Britannica, the Asteraceae family, also called Compositae, is commonly known as the aster, daisy, or composite family of the flowering plant order Asterales. It includes more than 1,620 genera and 23,600 species of herbs, shrubs, and trees distributed throughout the world, and is one of the largest plant families in existence. That's a lot of species. There are many well-known plants in this family, including many garden ornamentals, weeds, including dandelion, ragweed, and thistle, food crops, lettuce, artichoke, safflower, sunflower, and endive. And as we discussed in episode 9, Artemisia or wormwood, and in episode 51, Sang'er or xanthium. So we had quite a bit of Chinese herbs are in this family as well. Members of the family have flower heads composed of many small flowers called florets that are surrounded by bracts or leaf-like structures. Bell-shaped disc florets form the center of each head. Strap-shaped ray florets extend out like petals from the center and are sometimes reflexed or bent back. Another interesting article agreed with this overview and looked at how this family plays a role in human health, including antioxidant, anti-inflammatory, and antimicrobial activity, as well as diuretic and wound healing properties. And keep this in mind because we're going to see a lot of these come up as we discuss chamomile today. So it's definitely not just this herb, but this entire family has a lot of these effects. History. The word chamomile is derived from the Greek language with some Latin and French influence. From the Greek, it is derived from the word chamomile or earth apple, chame or on the ground, and melon or apple. The word chamomile first appeared in the 13th century and is similar to the Latin chamomilla. The oldest printing of this herb is from the Old English Illustrated Herbal from the 11th century. The 17th century, the Complete Herbal by Nicholas Culpeper, which is quite a famous text, has an illustration and several descriptions on chamomile. Chamomile is Russia's national flower, and chamomile has been used as a traditional medicine for thousands of years to calm anxiety and settle stomachs. People in ancient Rome, Greece, and Egypt used dried chamomile flowers and their essential oils as a medicinal herb. So that gives it at least 2,000 to 3,000 years old. So very commonly used. Some say this is one of the oldest used herbs. When I read that, my first thought was like, okay, maybe in the West. I'm not sure I'd ascribe that to the East, but still very commonly used and old herb. Non-medicinal uses of chamomile, according to Wikipedia. Chamomile may be used as a flavoring agent in foods and beverages, mouthwash, soaps, or cosmetics. It is used to upholster chamomile seats, which are raised beds about half a meter tall and designed to be sat upon. Chamomile lawns are also used in sunny areas with light traffic. And chamomile has historically been used in making beer and ale. Unlike for tea, in which only the flowers are used, the whole plant has been used to make beers and ales, adding a bitter flavor component favored by craft breweries and home brewers. Traditional uses, according to Srivastava and their team, traditionally chamomile has been used for centuries as an anti-inflammatory, antioxidant, mild astringent, and healing medicine. As a traditional medicine is used to treat wounds, ulcers, eczema, gout, skin irritations, bruises, burns, canker sores, neuralgia, which is nerve pain, sciatica, pain along the sciatic nerve, rheumatic pain, hemorrhoids, mastitis, which is inflammation of the breast, and other ailments. Externally, chamomile has been used to treat diaper rash, cracked nipples, chickenpox, ear and eye infections, disorders of the eyes including blocked tear ducts, conjunctivitis, nasal inflammation, and poison ivy. Chamomile is widely used to treat inflammations of the skin and mucous membranes and for various bacterial infections of the skin, oral cavity and gums, and respiratory tract. Chamomile in the form of an aqueous extract has been frequently used as a mild sedative to calm nerves and reduce anxiety, to treat hysteria, nightmares, insomnia, and other sleep problems. Chamomile has been valued as a digestive relaxant and has been used to treat various gastrointestinal disorders, including flatulence, indigestion, diarrhea, anorexia or lack of appetite, motion sickness, nausea, and vomiting. Chamomile has also been used to treat colic, croup, and fevers in children. It has been used as an emmenagogue and a uterine tonic in women. So an emmenagogue is something that induces menstruation. So it can be very useful for menses. It is also effective in arthritis, back pain, bed sores, and stomach cramps. WebMD, the website WebMD, there we go, WebMD says chamomile comes in many forms. So we're talking about dosage and preparation now. So sorry, I should preface this. They say chamomile comes in many forms, so there's no standard recommended dosage. They continue to discuss several forms of chamomile usage. To make tea, steep a chamomile tea bag in about 8 ounces of hot water for 5 to 10 minutes, or place dried flowers in a tea infuser. Honey or lemon juice may be added for flavor. Both of which, by the way, do have some medicinal properties. Honey is quite an important medicinal in Chinese medicine. Chamomile capsules are available and range from 250 to 1,150 milligrams per capsule. Studies have used 900 to 1,200 milligrams daily dosing. Chamomile oil is made by crushing and steaming the plant's flowers, which creates a blue oil. It has an earthy yet sweet, floral, or apple-like aroma. And this can be applied topically, may need to be diluted with a neutral oil in aromatherapy for massage or in baths. The PDR for herbal medicines says an internal single dose is approximately 3 grams as an infusion. Liquid extract 1 to 4 milliliters or 1 cup of freshly made tea is administered 3 to 4 times daily. Externally as a bath additive, 50 grams is added to 1 liter of water or 6 grams of drug for a steam bath. And washes and gargles may be administered several times a day. Holmes, who wrote the book I'm looking for, though, The Energetics of Western Herbs, says dosage is 6 to 14 grams for an infusion, 2 to 4 milliliters at 1 to 3 strength at 60% ethanol, and 1 to 2 drops of essential oil in a gel cap topped with some olive oil. He says an infusion should be kept covered to retain the essential oils, which is an interesting one, the essential oils, so keep a cap on it so they don't boil away. Thankfully, this is one of those Western herbs where I was able to find quite a bit on the Chinese medical actions. Again, not in our main text, so it's not commonly or very traditionally used, but it is used in Chinese medicine. ChineseNutrition.org says it is sweet, bitter, and cool. It enters the lung, large intestine, spleen, liver, and pericardium, and it regulates qi. Dai and their team discuss traditional Chinese uses of chamomile, but in terms of biomedicine. It nourishes the nerves and the stomach. It improves the appetite and relieves painful swellings and sweating, and is frequently used for chronic headaches, constipation, poor sweating, joint swelling, and urinary system disorders. It can strengthen the brain and muscles, can be a diuretic, and improves the menstrual flow, nourishes the stomach, and can be used as an appetizer. So in order to create appetite, I think is what they really meant there. It mainly treats symptoms of muscle relaxation, joint swelling and pain, stomach deficiency and anorexia, amenorrhea and urine retention. Chamomile can detoxify, clear heat, stop dysentery, dispel wind, and eliminate paralysis. Holmes, again, he's the one who wrote that Energetics of Western Herbs, which kind of puts a Chinese and energetic spin on Western herbs. And he has an entry on chamomile in his book, The Energetics of Western Herbs, and Materia Medica, Integrating Western and Oriental Herbal Medicine Traditions. He says chamomile is somewhat bitter, sweet, cool, and neutral. I don't understand that. When we say neutral, we usually are talking about temperature. So the fact that it's cool and neutral is antithetical. So I don't know exactly where he's coming from here, but that's what he says. So sweet, cool, and neutral. It enters the liver, pericardium, lung, Chong and or penetrating, and Ren or conception meridians, in addition to several traditional functions, which include relaxes constraint, relieves pain, and calms the mind, regulates the qi and relieves pain, reduces stagnation and harmonizes digestion and menstruation, clears internal wind and stops spasms, descends lung qi and relieves wheezing and coughing, promotes expectoration, and resolves phlegm, relieves allergy, promotes sweating, dispels wind heat and reduces fever, stimulates immunity and reduces inflammation, clears damp heat and reduces inflammation and swelling, promotes tissue repair, and benefits the skin. He also says, as I mentioned earlier, therapeutically, there's very little difference between German and Roman chamomile. Both are used similarly. He reluctantly says Roman chamomile might have an edge over German as a nervous sedative, and German may be more anti-inflammatory. So there you go. Slight differences, nothing to really differentiate between the two. And again, a lot of the scientific articles were mostly on the German chamomile, but when they mentioned Roman, it was like to say the same thing. It's used interchangeably. Contents of this. The plant contains 0.24% to 1.9% volatile oil, composed of a variety of separate oils. Approximately 120 secondary metabolites have been identified in chamomile, including 28 terpenoids and 36 flavonoids. We've talked about terpenoids and flavonoids before in our discussions of various herbs. A lot of herbs have flavonoids and terpenoids, many of which are considered to have some clinically relevant medicinal properties. So looking at terpenoids and flavonoids, we tend to look at them as to, okay, what does this do therapeutically? The principal components of the essential oil extracted from the German chamomile flowers are the terpenoids alpha bisabolol and its oxide azulines, including chamazoline and acetylene derivatives. Both alpha bisabolol bisabolol oxides A and B, and chamazolene or azulines. Again, I'm not good with these names. The first time I'm trying to do my best from the words. Farnesene and spiroether quiterpene lactones, glycosides, hydroxycoumarins, flavonoids, including apigenin, luteolin, patuletin, and quercetin, coumarins, including herniarin and umbelliferone, terpenoids, and mucilage are considered to be the major bioactive ingredients. So, just looking at these, we should be, what should be kind of piquing our interest a little bit right off the bat are coumarins and hydroxycoumarins, because as soon as we see those, we should start thinking about, maybe this does something to clotting in the body. So let's see what comes out of that. Other major constituents of the flowers include several phenolic compounds, primarily the flavonoids, apigenin, quercetin, patuletin, as glucosides, and various acetylated derivatives. Among flavonoids, apigenin is the most promising compound, according to Srivastava and their team. And apigenin heard a lot on some of the scientific papers, so definitely something to keep an eye on for its properties. So let's get into the science of this herb. This herb is commonly used, and there are several sources and scientific reviews of its actions. A recent review by Dye and his team, or their team, has a good list of its uses showing some scientific support. However, most of this evidence does not involve human clinical trials, so take these uses with a grain of salt. Anti-cancer. Several of them talked about, several different studies that I looked at, or reviews, talked about anti-cancer properties. So there may be something there. Antimicrobial. Several constituents have been studied and shown to treat fungi and bacteria, especially Helicobacter pylori, which is involved in gastric ulcers. In vitro, however, so in glass. So that's one of the issues. That means it's just it's not clinical. It's not in humans. It's in glass is technically what it means. It's in test tubes. So take it with a grain of salt. That may or may not mean it does that in humans. It is anti-inflammatory in animal studies, probably from the flavonoids we talked about earlier. It's antithrombotic from luteolin and other constituents. So antithrombotic means anti-clotting, which is what I was talking about with the coumarins and the hydroxycoumarins. The luteolin, I believe, might be one of those. Let me, if they fall under those. Yeah, it is. No, it's a flavonoid. So I'm not surprised to see antithrombotic properties. I'm a little surprised for the coumarins not to be mentioned in that context. It can be antioxidant. Volatile oil, polysaccharides, and flavonoids have been shown to scavenge free radicals in vitro again. Hypoglycemic in mice, so it might help diabetes. Antihypertensive in rats. Hypolipidemic in rats, so antihypertensive means it lowers blood pressure. Hypolipidemic means it lowers lipids in the blood, like cholesterol, lowers cholesterol levels. Anti-allergy in rats, antidepressant in rats, can protect the liver, lung, kidney, and stomach in rats or in vitro. So again, not a lot yet on humans. Has been shown to help polycystic ovary syndrome, PCOS, and reproduction in rats. Can be neuroprotective in rats, in other words, helping protect neurons. It can be analgesic, which is supported in a clinical study for migraines with an N of 72, so smallish study. So now we have an actual clinical study. Analgesic means it helps pain, so it might help the pain of migraines. So there you go. That's an interesting use of this. It may also be antidiarrheal and antispasmodic. They didn't really have a whole bunch of support for that, so I don't know where that's coming from. May also help in, it was like they had a setting, they had individual headings for each of these, and then at the end it said, oh, and it may also be useful for these sort of things, and just vomited out a couple conditions, which is where we're at right now. May also help in muscle atrophy, knee osteoarthritis, general anxiety, asthma, and skin wounds. Now, the general anxiety, which I would say is one of the more common uses in Western herbology, and I did see another study. I didn't include it because it wasn't it was not a well done study, but it said it compared clinically. It compared chamomile to some anti-anxiety medicines or anxiolytic medicines, and found that that chamomile was as good as or better than several of the drugs that were out there. Again, not a strong study, so I hesitated putting it in here, but I just want to say there has been some studies on that, and I think there's more ongoing research, and I think it's one of its most common uses is for anxiety. That's it really for what it can do in a positive way. So let's talk about some of the cautions. We'll start with talking about drug-herb interactions being an issue here. And based on coumarin being a constituent, or coumarins, different coumarins, being a constituent of chamomile, many experts and subsequently many scientific papers say it may have the potential to cause interference with warfarin. Warfarin is our main anticoagulant drug, and coumarin, one of the brand names for warfarin is Coumadin, and so coumarins and Coumadin very similar in their actions. One study showed that chamomile did not directly affect coagulation. I put that in here because I think it was an interesting study and I thought it was cool, but it's really beside the point because, however, there is also concern that interference with cytochrome P450, 3A4, and other subtypes are a concern and can interfere with warfarin and other drugs. So the issue that if you give someone chamomile and it does not affect coagulation, great. Okay, fantastic. Doesn't affect coagulation, which means those coumarins and hydroxycoumarins are probably not in high enough levels to make a huge difference. But we're not concerned too much about coagulation effects of chamomile. What we are concerned is if you mix chamomile with warfarin, are you going to have a drug-herb interaction? And there's a lot of ways you can have that interaction. Besides just the fact that chamomile has coumarins, which could be additive to warfarin. Warfarin is also quite sensitive to cytochrome P450, 3A4, and so if chamomile affects 3A4, it can also affect warfarin. Now, does it affect 3A4? Well, let's find out. Another study looked at cytochrome P450 interactions in chamomile, which we talked about a couple episodes ago. We talked about cytochrome P450 and how important that is in drug-herb interaction risks. So this study found the crude essential oil inhibited cytochrome P450 1A2, and to a lesser extent 3A4, 2D6, and 2C9. These are all different subtypes of the cytochrome P450, and different drugs will use different subtypes in their metabolism, and in other words, it gets changed in the body, usually for excretion. And so 3A4 is the most commonly, is the subtype most commonly used by drugs. 1A2 is it's 5 to 10%, I think. It's not very commonly an issue. 2D6 is the second or third most common, so it's a little bit up there, but even then it's only like 10%. But they concluded it is a strong inhibitor of cytochrome P450 1A2 and a moderate inhibitor of cytochrome P450 3A4. Now, you're looking at the slide I have up on the screen. It has a D in parentheses behind that, and that means the evidence on this is D level evidence, which is the lowest level of evidence. In order for it to get even into the C level, it has to have some human studies there. And so D level basically means the research was in vitro, that it was not clinical. We do not know how these work in humans, but I think there's enough here because warfarin is very sensitive. It has something called narrow therapeutic index, which is a huge risk factor for drug-herb interactions, and it utilizes cytochrome P450 3A4. Even though this is just a moderate inhibitor, it may be enough to warrant some concern over warfarin. I saw a study. It was looking at several hundred patients in the hospital to see if there's any chamomile interference with various drugs, and they basically concluded it did not have any interference with warfarin. But I think, out of those several hundred, I don't know how many people were on warfarin. It was an interesting study, but I don't know if I would not put it anywhere near conclusive. I think I'm always concerned with warfarin and adding herbs. That is just, it is one of those herbs that I do. One of my CEUs, continuing education, that I do is the 10 herbs and drugs you should be most concerned with, and warfarin is number 2. So I generally, with my patients, if they're on warfarin, I don't give them herbs in general. So I do think there's some concern here with chamomile. I don't think it's super strong, but I think it's there. Moving on, chamomile has also been shown to clinically interfere with cyclosporine, causing increased blood levels of the drug. So that's now sea level. We have a couple case studies. Again, not definitive. It's definitely something to be concerned about. There was one study, I didn't include it because it was German and I couldn't get my hands on it. All I got was an abstract, and it basically said there were 2 articles in the literature talking about chamomile interfering with cyclosporine. One of those increased the blood levels, the other one decreased the blood levels. So they said they were antithetical and inconclusive. But again, I couldn't get my hands on that. It was, I could only get the abstract. And even when I tried to get it in German, I figured Google Translate might be able to translate it for me. I could still only find the abstract of this article. So I'm throwing it out there. I think we need to be concerned about cyclosporine interactions here, but I don't know how much. And again, I'm going to say cyclosporine is a super heavy drug. If someone's on cyclosporine, I'm not sure I'm considering herbs for that patient to begin with. So, and to kind of wrap this all up in the risk factors for drug-herb interactions, the American Herbal Products Association's Botanical Safety Handbook, which is a big tome that talks about a lot of herbs, and they're good at ratings. They give 2 ratings. This is the first of the 2. We'll get the other one in just a minute. The first one is their interaction class rating, and it puts this herb in interaction class A, which is their highest rating. Herbs for which no clinically relevant interactions are expected. So again, there might be some concerns about drug-herb interactions here. I don't think they're super duper to be too worried about, but some to kind of keep in mind. Concerns for this herb. So Srivastava's team say a relatively low percentage of people are sensitive to chamomile and develop allergic reactions. So in my reading, I think that's one of the biggest concerns is the allergies. And it makes sense. It's a daisy. Remember, we talked about this family having ragweed and thistle, all these things that are allergenic. So I think allergies are certainly a concern here. People sensitive to ragweed and chrysanthemums or other members of the Compositae family, which is Asteraceae, this family, are more prone to develop contact allergies to chamomile, especially if they take other drugs that help to trigger the sensitization. They continue to say it is possible that some reports of allergic reactions to chamomile may be due to contamination of chamomile by, quote, dog chamomile, a highly allergenic and bad tasting plant of similar appearance. So that would be some of the concerns there. WebMD says for some people, chamomile can cause side effects that range from mild to severe. Potential side effects include allergic eczema and eye irritation from skin creams with chamomile, drowsiness, nausea or vomiting when taking chamomile in large doses, an allergic reaction, especially if you're allergic to related plants such as ragweed, daisies, marigolds, or chrysanthemums. And Gardner McGuffin, who is that botanical safety handbook that we talked about earlier, does put this in the safest category, safety class 1. herbs that can be safely consumed when used appropriately. So I don't think there's a whole bunch of concerns here. Like most things, we do need to be a little bit concerned about allergies, but that seems to be, to me, the worst of it. Mount Sinai Hospital, their website says chamomile may make asthma worse, so people with asthma should not take it. Pregnant women should avoid chamomile because of the risk of miscarriage. I didn't see that in the literature. Chamomile may act like estrogen in the body, so women with a history of hormone-sensitive cancer, such as breast or uterine cancer, should ask their doctors before taking it. Totally disagree with that. Estrogenic herbal compounds, the more they've been studied, the less we feel like they do act like estrogen in the body. So I just, my research on that says that's not true. If you are allergic to asters, daisies, chrysanthemums, or ragweed, you may also be allergic to chamomile. Drinking large amounts of highly concentrated chamomile tea may cause vomiting. Chamomile may cause drowsiness, so do not take it and drive. This is like a doctor writing this. Chamomile does not cause drowsiness. It kind of tamps down the brain a little bit. I wouldn't say that's drowsiness, and I wouldn't be too worried about taking it and driving. It's not like it's a sedative or anything along those lines. It's just the way I would say it is it calms your mind. That's how we would put it in Chinese medicine. It's more of a mind calmer, and that helps you get to sleep. I do think it's helpful for insomnia, which is not something we've called out specifically, but I don't think it's because it causes drowsiness. I think that's a very Western approach to drugs and doesn't apply here, but they put it there. So, and it says, stop taking chamomile at least 2 weeks before surgery or dental surgery because of the risk of bleeding. I saw another article that specifically said there's no concern about this. They studied it, and there's no concern about that at all. So Mount Sinai, I think, was being ultra conservative in the recommendations, and I don't necessarily agree with them. I don't think there's a huge risk of bleeding from chamomile. Again, that would come from those coumarins and hydroxycoumarins that we were talking about earlier, but I just don't think clinically we've seen any. There was that study that said it does not affect clotting at all, which is what is the risk of bleeding would be concerned here. So I don't agree with that as a concern. Okay, well, there we go. We made it through another herb. We started our discussion today by continuing our conversation about the Chinese medical pulse, discussing the slippery pulse quality. From there, we did our deep dive into chamomile, a very commonly used herb for a variety of conditions, especially anxiety and insomnia. And the science shows it may be effective for many conditions. While generally considered to be safe, there are some potential precautions. As I said, probably the one that I'm most concerned about is allergies. Overall, a very interesting herb, which, while still needing more evidence, seems to kind of do what it is purported to do. Again, need more evidence to say that definitively, but I think that's where this is one of those I'd put in the category of probably effective as far as herbs are concerned. In our next episode, we will be exploring a relatively commonly used and important Chinese herb, Dao Ren, or peach kernel. This herb is used in Chinese medicine to regulate or move the blood, which can be used in a wide variety of conditions, including menstrual disorders, traumatic injuries, and different types of pain. Plus, as a seed, it can moisten the intestines and unblock the bowels. And as usual, we will be exploring something a little different. As we've already mentioned, that might just be the wiry pulse. So please join us for this interesting and useful episode, and we'll see you in 2 weeks. With that, I'd like to thank you very much for listening. If you like this podcast, please do us a favor. Give us a 5-star rating in your favorite podcast app. We're on all of them, and we really appreciate it. Thank you. And remember, you can get CEUs in continuing education units and National Certification Commission of Acupuncture and Oriental Medicine professional development activities at www.integrativemedicinecouncil.org. That's Integrative Medicine Council, COUNCIL.org. You can always get in touch with me at Dr. Greg at spurbsherbs.com or our website, www.spurbsherbs.com. You go to the store and get those specials on those books at spurbsherbs.com as well. And as usual, we have our bibliography. Thank you.
Spurbs Herbs.
The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy
Thompson.
Dobbins.
Rogers.
Campbell.